We're going to start with Dr. Seligman, who's going to share a little bit with us about her work, which is really involved with what are the health implications of how people interact with the kinds of foods that they have access to. What are the implications for our bodies? What are the implications for our communities?
Thank you. Well, really, the place to start is understanding that there is no question that food insecurity is bad for your health. And it's bad for your health at every stage of the life course. There is now decades of research among children that show children who are food insecure or live in households where there is not adequate access to nutritious food have decreased intellectual development, poor emotional development, and decreased cognitive development, in addition to a number of health problems like asthma and iron deficiency anemia and symptoms of anxiety and depression. We know that these children are also at higher need of being hospitalized and going to the emergency room. Pregnant women who are food insecure have smaller, sicker babies. They're more likely to be food insecure. And they're more likely to have iron deficiency anemia. And adults who are food insecure also tend to be more ill. They have more diet-sensitive chronic disease like obesity and diabetes, more mental health problems, and poor general health status, which is important because your general health status, or how you respond to the question, how in general would you rate your health, is very tightly correlated with your risk of death. So we know that food insecurity and health are intertwined in really important ways. And there are two ways that I think we should concentrate on. The first is that being sick in the US costs a lot of money. And we know that out-of-pocket healthcare expenditures are often very high in food insecure households, and illness and disability makes it more challenging for people to earn a stable income, and these drain the household budget and make people more likely to be food insecure. So your income is low, you're more likely to be food insecure. We know, for example, from our Hunger in America studies of food pantry users that 66% of people coming to the food pantry report that they had to make a choice between buying food and buying medicine or medical care. So that's the first reason, is it costs a lot of money to be sick in the US. But the second important reason is that if you live in a food insecure household, you engage a number of coping strategies in order to avoid the physical sensation of hunger. Nobody wants to be hungry. We're hardwired to avoid that. And those coping strategies are really adaptive in the short term. They keep you from going hungry, but they aren't adaptive in the long term. So for example, if you shift the foods you eat to cheaper foods that tend to be highly processed, very energy dense, nutrient poor foods, and away from relatively expensive foods like fruits and vegetables, that may be good in the short term, but it's not good for you in the long term. Similarly, if you anticipate that you're not going to have enough food at the end of the month, and so you eat a lot of food today, tomorrow, and the next day in order to buffer yourself against that time period when food runs out, we know that is bad for your health in the long term and predisposes people to obesity and diabetes. So food insecurity is likely to make you ill, and once you get ill, you're more likely to be food insecure. So very complex relationships.
Terribly unfortunate. Thank you for painting that picture. Now, Eli, having heard that, I'm wondering if you can give us a little bit of the broad brushstrokes of the Bay Area and tell us a bit about the policy work that you do.
Yeah. And it's funny you introduced me as liking numbers, because I do like numbers. And so what I thought I'd start with is painting that picture, just like you said, to give the audience a sense of where we're at today. And I'd say it doesn't look very good nationally or here in the Bay Area when it comes to hunger and diet-related disease. So UCLA does a survey pretty much constantly asking people health questions. And one of the questions they ask is, did you have difficulty affording food? Did you reduce the amount of food you ate this week or the number of meals you had? And what they found is here in the Bay Area, about 11% of adults report being food insecure. Or put another way, that's 1 in every 8 people here in the Bay Area, adults, saying they're skipping meals or they find themselves hungry at some point. That's better than the state of California as a whole, where it's closer to 1 in every 6 people, which is about what it is nationally. So if you looked around and you picked 6 people and you chose one of them, that's the number of people in California nationally who are saying, I'm having trouble affording enough food. Like Hillary was saying, that has huge impacts on health, specifically through diet-related disease. And over time, we're not doing so great on that either. Today in the Bay Area, 1 in 5 adults are obese, and that's up significantly in the past 15 years. And in California, it's a quarter, 1 in every 4 adults. Rates of diabetes have gone up significantly also in the past few decades. And I'll say on the food insecurity, those numbers have also gone up significantly, and there was a huge jump right at the recession. The third way you can paint the picture or think about why would we care about these issues is not only is access to healthy food have impacts on hunger and health, but is also a question of quality of life. The way we think about that is that there are people in some neighborhoods in San Francisco or pick any city where it's just a walk down the street to find food that we would consider healthy, wholesome. And there are people across town in neighborhoods where they have to travel a far distance. They have to get in a car, they have to get in a bus, they have to walk a really far way, and it's much less convenient for them, just at a basic level. It's an issue of quality of life, convenience, and also one of equity. So for us, when we think about why should policymakers care and why I hope you all care, it's for those 3 reasons. And then the thing I wanted to end with in terms of framing this is that when we think about, well, what is it that's stopping people from accessing healthy food? Why aren't more people eating healthy? It really comes down to 4 barriers. One is physical. Can you find healthy food? So that's what grocery options are there in your neighborhood? What does the corner store offer? Do you have a farmer's market? It's physically, what can you find? Then the next barrier is an economic barrier. So you can find the food, but can you afford it? And I think we'll be talking a lot about that tonight, so I won't dwell on that too much. The next is, even if you can find and afford the food, do you know what to do with it? So that's an educational barrier. Do you know how to make healthy choices? Do you understand nutrition? Do you know how to cook? That can often be a barrier to eating healthily. And then lastly, it's not the best term, but cultural barrier. And that's really, do you want it? So you can find the food, you can afford the food, you know what a healthy choice is and how to cook it, but do you want it? And I think one of the best examples of that is when you look in the school meals context, kids love pizza. And they also love Red Hot Cheetos. And getting kids to want something else is a cultural shift, a change in demand. And so strategies to try and address that really get at making it easier for people to find, afford, and choose healthy food. And I think that's where the policy interventions we're talking about fall into one of those kinds of categories.
Thank you, Eli, for that summary. Now, Doria, in terms of taking it home and grounding this in a community for us, can you tell us a little bit about your work at Urban Tilth?
Right. So it's always interesting to hear the numbers when you're living the experience, the reality. Urban Tilth is a 10-year-old organization running in Richmond, California, which is in West Contra Costa County across the bay. It's kind of in the shadow of Chevron, the Chevron refinery. Most of our work happens in the flatlands where people are primarily low-income people of color, very low-income, no-income people of color, immigrants. We have 1 grocery store for 130,000 people. It's a Foods Co., so it's not a high-end grocery store. It's kind of a low-cost, kind of everything in boxes on shelves type of thing. If you do not have a car, you are most likely getting your food from the corner store mostly. And then when you have an access, when you have time, when you have a car, when you have somebody to give you a ride, you'll go to the grocery store. There are a lot of people in our community who have trouble getting enough food, affording enough food to eat. There are a lot of crisis food programs, soup kitchens, the food pantries, all these different things. There are a lot of people who are sick, who are obese, who are struggling with heart disease. There are a lot of children who are obese. West Contra Costa County has one of the highest rates of childhood obesity in this area of California. Over the last 10 years, Urban Tilt has really been working on those last two elements of what Eli talked about, like really working on changing the culture of food so that people have a desire to even want to eat healthy food. Because I think that the condition of being poor, when you are constantly stressed to work, multiple jobs, you're tired when you get home, you need an easy solution. And unfortunately, in our community, the easy solution is something that's high in fat, high in sugar, low in cost. In order to change that culture, it's a matter of changing your taste, yes, like wanting to come back to actually liking the taste of fruits and vegetables, because what we get at Foods Co. is not the highest end fruits and vegetables out there. They don't always taste the way that people remember them if they had grandmothers and grandfathers who grew things at home. So oftentimes kids will say, well, fruits and vegetables are nasty, right? So Urban Tilt has been working there. We've started 13 different school and community gardens across Richmond. We have a series of gardens along public parks where you can actually just go out, they're grazing gardens, and anyone at any time can harvest food and take it back home to amend their week's supply. And people will do that. I actually just did that on Saturday. Walked my dogs and I picked some greens and some mint for home for breakfast. We also teach about how to cook, right? Because most of the kids these days are growing up, spending a lot of time by themselves because their parents are out working or their parents are struggling with other issues of addiction or other things, and they don't know how to cook. They know how to open a package and put it in a microwave or put it in boiling water, and that's cooking, right? So we always have an element of cooking to all of our programs. And with that, we make it a social experience. Because so much of the work that's been done around food is kind of tabled in nutrition and, shoulds and shouldn'ts. And I think that people kind of know the shoulds and shouldn'ts in general, but they don't get that feeling of warmth and fun and kind of hanging out with your friends and we're gonna make some food together, often in the context that we normally deal with changing people's food habits. And so, for instance, at Richmond High School, we run an urban agriculture and American food systems class. It's an elective that kids take for a year. And every Friday they cook together as a group. They cook their lunch from the garden, from the things that they've been growing. And it's a serious social time where they hang out and they talk about it. And we try to make things, the teacher of the class actually talks about how he tries to make things where folks in the class would want to cook it for their boyfriend or girlfriend. It's something kind of cool, something interesting. And that's exactly what happens. They'll go home and they'll make these meals for their parents. A cultural shift, right? I think that it's so hard to get at all of the different factors that are driving the state of health in underserved communities. To really put your thumb on the pressure that we have, not just from access, but from poverty and from stress. And from even having the wherewithal to make the space to cook or having the equipment to cook. So Urban Tilt has been working in that space of trying to create a cultural space where things can slow down, where we can grow together and it's okay to spend that time, where we can cook together and it's okay to spend that time, where we can reclaim public space and create new access points for healthy food, and it's okay. We have that space, we have that time. That's where we've been working, and for the next 10 years, we're looking to work somewhere else, and we'll talk about that later.